after the numbing cream just felt like sandpaper. Just kind of going over my skin with this little pen that felt like a sort of a sandpaper device. If you've ever had a kitten or a cat lick your face, it kind of felt like that. So it wasn't uncomfortable. I'm still a little bit numb around my lips, but otherwise, yeah, it just feels like I've got a sunburn. My skin feels kind of tight. Hey everybody, welcome to Beyond 50 Skin. My name is Cindy. If you're new here, welcome. If you're a returning subscriber, nice to see you again. So glad to have you here with me today. Today I'm going to talk about microneedling, my experience, the decision, why I wanted to have microneedling done, and a little bit of the history about microneedling, prep work for microneedling, and aftercare for microneedling. So if that sounds interesting, let's jump right into it. Before we get right into the discussion of microneedling and why I chose to have microneedling done, I want to talk to you a little bit about my skincare history and my education in the field of cosmetology. 15 years ago, almost 16 years ago, I got a degree in cosmetology. It was a bit on a whim. I was really excited. I got into the field, started my own little business, and then my family had a really big cross-country move. And in the new state that I moved in, it was California, none of my education transferred at that time. I believe that that's different now. Some of the credits would transfer and you could sort of jump right into the field a little bit faster than you can, or you could back when I was in school. But anyway, so when I got to California, I decided, you know what, I'm gonna just go back and get my master's degree. And if you've watched my welcome video, you know a little bit about this. And if you've read my lower deck, you might know a little bit about my history. But so I started to go back to school for occupational therapy, and I just left my entire skincare routine behind. I left cosmetology behind, and I never really got back on a really good regimen. I had been a cosmetologist and I'd started out in hair care, done a little bit of nails, but I really ended up in more the aesthetic side of cosmetology. I did a lot of waxing, a lot of spray tans back in the day for the short time that I worked as a cosmetologist. So that gives you a little bit of a backstory of why I'm so interested in skincare. I really abandoned skincare, and around 2016, you know, I've talked about my perioral dermatitis and the fact that I kind of looked in the mirror and really didn't recognize myself. Of course, I was premenopausal and there was a lot of stress in my life, and it was just a crazy time. But one thing that I felt like I could grab onto is, okay, let's get this skin under control. And I started with just the basic skincare routine. I decided to start Latisse to grow my lashes just because I felt like that would be kind of a little treat to myself. I'd always wanted long lashes, and I did a video on that, and I'll link that. So I started getting on a more anti-aging skincare routine after starting with the basics. I started talking to my dermatologist, and we decided to get me on some Retin-A and some vitamin C, and she sort of taught me a little bit more about a really strong anti-aging skincare regimen. And so I switched up my whole skincare routine, and I've been on that since about 2016, 17. And then I was like, okay, I've got my skin under control. What next? And like all this pigmentation. So then I started on the journey of like trying to reduce my pigmentation and kojic acid and some hydroquinone products. And I really got that under control. All those products that we had been working together on and that I had been using consistently were really paying off. And I wanted to look into medical aesthetic procedures. And so we started talking about lasers and what type of lasers were out there. And she educated me a lot on the different options that I had. And I eventually decided that I would prefer one treatment with a more intense laser procedure as opposed to 3 to 4 treatments that were lighter to really get the skin rejuvenation that I wanted. And so I pursued that, and I ended up getting laser, and I am going to do a full video on that, but I wanted to really put that aside because it's a very in-depth video. Anyway, you'll see in those videos that it was a big deal. But I wanted to kind of keep this YouTube channel kind of contemporary and what I'm doing right now. So one thing that I am doing right now is microneedling. And the reason is because when I had the laser treatments, I was left with some scarring. I will link some pictures to show you the residual scarring that I have. And I also had surgery during this period of my life, and thyroid surgery, and I was left with about a 6-inch scar. It started out as a small inch scar. There were some complications that ended up having to be much larger. So the reason that I decided to do microneedling, which is the topic today, is because I had some scar revision that I wanted to manage through due to the lasering procedure that I had, and scar revision due to my thyroid surgery.
As you can see in this video, after my laser procedure, I healed with some hypopigmentation grid lines sort of running horizontally across my face. Now that the scar is mature, I can start addressing this with some microneedling appointments, which will break up the scar and remodel it by rebuilding collagen. I'm hoping to get an improved outcome, as well as an improved outcome with my thyroid scar.
So that's kind of the rationale of why I started looking into microneedling. So I'm going to share with you my first treatment. Good morning. So I've arrived at my microneedling appointment. I'm a few minutes early. And I thought I would check in with you guys and let you know kind of what I did for my skincare this morning to prepare. I basically just did very basic skincare, just a quick wash and a little moisturizer. There's no actives involved a few days before you do your microneedling. So I haven't used Retin-A for a couple days. I did a very light lactic acid treatment in the mornings, but nothing in the evenings, just really basic skincare. Back to the basics. Wash or cleanse and moisturize. That was about it. Hey everybody, so I've just come back from my microneedling appointment. Took a big floppy hat to keep that sunshine off and some big old glasses because I can't wear sunscreen today. So I'll be staying indoors for a good part of today and probably tomorrow too, depending on how my skin's doing and if it can tolerate some mineral sunscreen. To tell you, the procedure after the numbing cream just felt like sandpaper. Just kind of going over my skin with this little pen that felt like a sort of a sandpaper device. If you've ever had a kitten or a cat lick your face, it kind of felt like that. So it wasn't uncomfortable. I'm still a little bit numb around my lips, but otherwise, yeah, it just feels like I've got a sunburn. My skin feels kind of tight. So yeah, not all that uncomfortable a procedure at all. Nothing like the CO2 laser recovery. This is going to go away in about 3 to 5 days. I'll be completely back to my normal skin tone. Tomorrow I can start doing my regular skincare as far as cleansing and moisturizing and putting the growth factor that my medical esthetician gave me to put on as a serum. And then by Friday, which is 4 days from now, I will be able to go back to my full skincare routine. So jumping backwards a little bit, microneedling. It's also called medical needling or collagen induction therapy. So there are a couple different names for it. It kind of came on the scene in about 2014, but has really been popularized over, I would say, about the last 5 years I've been hearing about it. The procedure that I had uses the 3mm needle. The 3mm needle depth causes a wound to your skin, right? It causes bleeding. And so in response, your skin goes, whoa, and so it has the wound healing cascade that jumps in. And you get growth factors that come to the surface of the skin, platelets, and this healing response. And the healing response is what actually causes the resurfacing of the skin and the formation of collagen and elastin. And the growth factor that comes to the surface of the skin specifically is TGB3, transforming growth factor beta 3. And the collagen that is stimulated is collagen 1, which is a lattice work collagen, kind of when new skin forms, as opposed to collagen 2 and 3, which is formed when we have scar healing or scar formation, I should say. Really specific type of wound healing targeted to create and stimulate elastin and collagen and sort of get these growth factors up and running again so that we have improved scars, improved fine lines and wrinkles, and improved texture to our skin. As I said, has been around since about 2014. One of the pioneers was Matthias Aust, and he wrote a paper and did some clinical trials and showed that the microneedling pens can give you like a 205% increase in your dermal thickness. So that's going to help definitely resolve some fine lines and wrinkles and also do skin smoothing, and it's also going to modify some of the scarring that I had. Good morning, post microneedling day 3. As you can see, all the redness is down, looking really good. A little series of pinprick dots kind of over where the thinner areas of skin are. Really smooth. A little bit itchy last night, so I was using some hydrocortisone, but otherwise, love the results. Also the scar area here, looking fantastic, and I have a few more treatments there for sure. And And then tomorrow I'm going to be going for my second microneedling treatment. The microneedling treatment that I'm going to be doing is medical microneedling. So let's get into a discussion about the difference between medical microneedling and cosmetic microneedling. Before talking about medical microneedling and cosmetic microneedling, how they differ, etc., I want to talk a little bit about risk assessment. We all know that we have different levels of risk that we're comfortable with, and I want to be really clear in my videos that my level of risk is going to be very different from your level of risk, and I want you to know that I respect any decisions that you make. Everyone has their comfort zone. Everyone has different levels of, how they feel about aging and whether they would prefer to do very less invasive treatments and just great skincare, which is fabulous. It can get you so far with your skin rejuvenation journey, or if you want to pursue more medical aesthetic procedures. So I just wanted to acknowledge everyone has a different risk assessment and to tell you that I respect you for whatever decision that you make regarding your own level of risk assessment and decision to go into either further medical aesthetic treatments or to stay with just an awesome anti-aging skin routine. So when it comes to microneedling, people have really strong opinions. There's people that just say you should never do something that invasive. It's dangerous. You could scar. It could cause infections, and that's very true. So it's really important that you, number one, assess your risk. Number two, educate yourself so that you're aware of your own medical history, whether you're a good candidate, some preparatory steps that you're going to need to take, especially if you have a history of cold sores, and to decide if your skin is able to tolerate the treatment. So it's always important to educate yourself, to talk to your medical provider, and to look at the risk factors involved in any medical aesthetic procedure. Let's talk a little bit about the difference between cosmetic microneedling and medical microneedling. So cosmetic microneedling is a needle depth of 0.02 millimeters to 0.25 millimeters, and above that is really considered medical microneedling. The FDA considers medical microneedling anything beyond 0.3 millimeters of needle depth. So in the cosmetic microneedling realm, you're going to be kind of getting off that epidermis, those loose skin cells, the keratinized skin cells, help those slough off, and you probably be able to get your products to penetrate more deeply. But the thing is that not all products are meant to penetrate really deep into the skin. So if you're using product during a medical microneedling session, you want to be really careful what you're putting on your skin. And there are protocols on what to put on your skin and what you really want to avoid so that you do not get granulomas post-procedure. But if we're just talking about the cosmetic depth, then it's okay to do a really kind of robust skincare routine after, because you're not really puncturing into a depth where you are getting into the layer of skin where you're going to cause infection if you add some inappropriate topicals or granulomas. You're just resurfacing the skin. So now that I've kind of clarified what medical microneedling depth is versus cosmetic microneedling depth, let's talk about why you would choose one over the other. It really comes down to your skincare goals. If you want to kind of slough off some of that surface pigmentation and buildup of keratinocytes, and you just kind of have that dull complexion and you just want a brightening procedure and you want your products to penetrate better, then definitely cosmetic microneedling would be for you. You can go to your local esthetician, set up a few sessions. There's no downtime. You're going to have such a nice result, and you can get back to a fairly robust skincare routine, and your products are really going to work much better for you. But if you're looking at collagen production, reducing fine lines, minimizing the appearance of scars and stretch marks, then you're really considering medical microneedling. That's going to mean more downtime, more significant aftercare, and also more significant prepping for your procedure. If you're going to do medical microneedling, you're going to have to cut down on all your actives. You're going to want to talk to your doctor about getting on some antiviral medications if you get cold sores, and you're also going to want to really discuss what the aftercare is going to be. You're going to come home and you're going to have a day or two where you're going to be really pink and red. You can have some pinpoint bleeding, and you're going to be very minimal in your aftercare skincare routine. So they're very different procedures. With all that being said, I want to wrap this up for now, and then I'm going to talk a little bit about my prep routine and my aftercare routine. This will be my second medical microneedling appointment. I'm on a protocol to get 4 to 6 for scar revision. That's fairly typical, and usually they're spaced out 4 to 6 weeks apart. But of course, this year that wasn't possible. So I'm just getting back to getting my second treatment now. But I will record the results of all 4 to 6 treatments and kind of do a wrap-up video after I've completed the whole protocol, and we can do some before and afters and see what you think. But I wanted to talk about kind of getting ready for your medical microneedling appointment. Of course, you will have already had your consult with your provider. You want to make sure you've prepared for it. You're certainly not going to be going out. You don't want to have to put makeup on and sunscreen on. No, you're going to be coming home right after your procedure and kind of just having a really quiet skincare day. The one thing that I am going to add to my procedure after I get it done this time is I'm going to go have an LED treatment. Some of you know, I've been talking about that I'm in getting my cosmetology license reinstated, and I'm going to be going to the school that I go to, and I'm going to go for an LED light treatment. And that's a whole nother topic, LED, but it's very healing. It'll take some of the heat out of my skin and really set me up for a good recovery. Now that first 2 to 5 days, it is a bit of recovery. Your skin's going to kind of return to normal, at least in the coloration, but you might have some flaking, typically around the mouth and the sort of the thinner skin areas. After my first procedure, that was where it kind of flaked around my collarbone and kind of around the mouth area and right kind of under the eye orbit. So expect to have some sort of flaking, and your skin is going to be in recovery mode, and that's the whole point. You're wounding your skin so that you set it into that wound healing mode where the growth factors come rushing in, and you want to build that collagen. That's the whole point of this, collagen 3 and collagen 1. That's the whole point of going through this procedure. You're just going to be remodeling your skin, and so you want to give it the best chance it has for recovery. And so it's really important to follow these post-procedure directions to the letter. So I'm headed out the door for my procedure. I'm going to show you a couple pictures right after I come out. So hey everybody, I'm just back from my microneedling and LED treatment. I'm pretty red, a lot of erythema, and the pinpoint bleeding has completely stopped, but I'll be pretty pink for the next 5 days. But tomorrow morning I'll start in with just a gentle cleansing routine and continue with my growth factor serum. Up to about 20 hours, and then sort of discontinue the growth factor serum. There's a little bit of controversy whether that really does any. The structures are so large that they can't really get into the skin after about 20 hours because everything is sort of closed up. But I would also want to let you know I'm drinking lots of water, and one thing I want to share with you is my Sleep and Glow pillow. Like, I know people get fussy when people kind of hawk this on YouTube, but I got one over a year ago now, and I absolutely love it. It's fantastic post-procedure because you can sleep on your back comfortably, you can turn to the side, and your face is offloaded and not touching. It really is fantastic. I may or may not be able to get you a code, but I wanted to share this with you. At the moment, this is not an ad, but if it is, then I'll put it in the description down below. But I really love it, and that's all I'll say about it. But it's really been a lifesaver for me. It's kind of helped me with some neck pain that I've had. It's really changed my sleeping habits, and I love it. And it also really helps post-procedure. So I will leave that as just a slight plug for that, but only because I really love it. Also, I wanted to let you know that I won't be wearing sunscreen today. I'm staying inside. I wore my floppy hat and my big glasses home, but tomorrow, if I need to go out, I will be putting the Pure sunscreen. It's by Dr. Jart. Dr. Jart, I love it. I'll show you, it's kind of got a green tint, and it does a really nice job. It's a mineral sunscreen. Of course, after this procedure, after microneedling, you want to wear mineral sunscreen only. And I love this because it gives you a little cover up. The green tint just sort of camouflages the redness in your skin, sort of offsets, green offsets red. So I really have used this multiple times post-procedure, and I really like it a lot. It's only a 30 SPF. So if you're thinking you want a 50, then maybe you'll go for this one by Dr. Dennis Gross, his mineral. So that's a 50 SPF. So if you want a little bit of a boost, you maybe put a layer of this on to kind of give you some good cover up, and then a layer of this on for some added protection, SPF protection. And that's it for today. I'm just gonna kind of take it easy, drink my water. So that wraps up today's video about microneedling. If you have any questions, please leave them in the comments below. I'd be happy to answer them. And hopefully you learned a thing or two today about microneedling that you may not have known. And as always, I always enjoy this time that you spend here with me. I really like making videos for all of you. And if you would like to subscribe, click the notification bell and tag a friend. That's always awesome. And I hope you guys have a fantastic day. Like I said, if you have any questions on microneedling, please leave your comments down below. I'd love to hear if you've ever had microneedling or if you're thinking about it, sort of your thoughts on it. And I hope you have a wonderful day. Take good care. Bye. So my skin's all fresh and ready for microneedling. I'm a little nervous. Yeah. Looking fantastic, and I have a few more treatments there for sure. Have a great day, guys.